Welcome to IAPA updates from the Illinois Academy of PAs. Here in Illinois, we have an access to care crisis. More than 3.5 million Illinois residents live in health professional shortage areas, which means that they don't have access to the sorts of basic primary care services and specialty care services that we take for granted in some of the more urban and affluent areas of the state. PAs are part of a solution to that problem. And here at the Illinois Academy of PAs, we think that we have some good ideas about how we can expand access to care through modernized PA practice. And today I had the opportunity to speak with Deborah Epstein, who's a PA here in the Chicagoland area practicing interventional radiology. And we talk about her thoughts on how PAs improve access to care in her practice and expanded access to care in primary care in general and how PAs contribute to that. So please stay tuned here for my conversation with Deborah Epstein, PAC. So typically when we think about access issues and how PAs can expand access, what we're thinking about are rural communities or communities where there isn't a lot of healthcare. But what we actually understand, those of us who work in more urban centers, is that access can be an issue even at bigger hospitals, right?
Yeah, absolutely. I mean, I think especially coming out of the COVID pandemic, it was really a crisis for healthcare where, urban, suburban, really almost every kind of setting, especially here in Illinois, was affected. And there's lack of access to care across the board, getting into primary care, getting into urgent and emergency care. We see longer wait times. And then even those of us that work in specialty fields, there's long waits for procedures and visits with specialists as well.
Yeah, for sure. I mean, dermatology is always the big example that comes up, right? Most people in even well-resourced communities understand that some of these specialties, there just aren't enough physicians to meet the needs of those communities. And so even in those more affluent and more well-resourced communities, we see an opportunity for PAs to step in. And again, not in lieu of physicians, but in addition to physicians to really expand access to care. So I know in your specialty in interventional radiology, you have some experience with that. So tell me a little bit about how you see PAs in a procedural specialty such as IR helping to expand access to that limited resource.
Yeah, absolutely. I think I've really, been honored and to be able to expand access to care where I work in interventional radiology because it is an area that's in growing demand. We do more and more things in interventional radiology, and there are not enough providers.
Mhm.
And oftentimes, some of the smaller, lower risk, lower acuity type cases get put off because the physicians really need to focus on things that are those larger, more critical, more urgent cases. And I think that's where I've really found a niche in my practice is that there's a lot of these biopsies, thyroid nodules, lymph nodes, things like that are really critical to patients because a lot of times this is getting them a cancer diagnosis or reassurance that it's not cancer. And there was always increasingly a longer and longer wait for these procedures. And I said, this is well within my scope of the skills that I have. These are low risk procedures, and this is a service I can certainly offer to get these people in more quickly and give them the time and attention that they deserve to help calm their nerves and get through the procedure. A lot of times, um, prior to me doing this, people were being squeezed in between a lot of these
Mhm.
emergent cases and probably weren't getting, the care and attention that they really deserved.
Yeah, you brought up a lot of really good points there, and I want to unpack it a little bit. So, I mean, when we think about how health systems think about the economics of healthcare, right? There are metrics around productivity and sort of the value of care, and sometimes the priority is given to those procedures that are maybe not just more important to the patients or more critical from an acuity standpoint, but maybe are greater revenue generating, right? But when you zoom into the patient level, to that individual patient that needs that thyroid biopsy or needs that diagnosis, right? That may seem like a minor procedure to us at a system level, but to that individual patient, it can make a really big difference. And so when we think about how can PAs really impact care, it's not just about the numbers and the throughput, but it's actually the impact on the patient as well.
Yeah, absolutely. I mean, and you bring up the economics of it, which is a whole other discussion for another day. But I do think that that's where PAs and other APPs can really be critical. Is some of these procedures that do reimburse lower, there's a higher profit margin to have a physician assistant perform those procedures than paying a physician who honestly, their skill set. Um, it goes beyond what is needed for those procedures. And so,
Yeah.
and unfortunately, at the end of the day, medicine is business. You got to keep the lights on, as they say. And so I think that's a really smart way to be sure that the physicians are being the best utilized, and then allowing the physician assistants to do some of these cases that are not big revenue generators and also, lower acuity.
Yeah, it's the thing that we see when we look at the numbers about, not just APPs or PAs in procedural areas, but just sort of writ large. When there's this argument that you hear sometimes that PAs are somehow taking patients away, like that's an either or sort of comparison, right? Who would you rather be with, the PA or the physician? When the reality is it's not usually an either or kind of situation. What we see is that when PAs are allowed to practice and are added to teams, that sort of a rising tide lifts all boats, right? We see more
Right.
patients are getting access, and patients across the spectrum are getting access, right?
Yeah, that's exactly right. And so, I mean, I think that it allow by me doing these procedures, we get more of those types of procedures in. So we are doing more biopsies because I'm working parallel to the physician who's now also freed up to do more of these, higher level cases, that their day isn't chopped up into these smaller blocks with all these other cases in the mix. And I've seen
Mm.
that through the years in my practice, that the physicians that I work for have increased the types of cases they do. They do a lot of cutting edge interventions that previously we really just didn't have the time to offer. And so, it's allowing everybody to participate in expanding access in all the directions.
Yeah, it's using teams, right? PAs
Correct.
working along with physicians and technicians and nursing and, really expanding access. So, I mean, this is sort of a micro example of what we're talking about at the state level about how PAs can expand access to care. And again, the argument is sometimes packaged as an either or, as if we're taking patients away from physicians, but really that's not about what it is. It's about getting patients to the right um, the right provider at the right time, or the right clinician at the right time, and making sure that we can provide those services that are critical to them. And the economics is not to be downplayed either, right? We got to
Mhm.
move people through the system. We've got to generate revenue at the end of the day to be able to provide those services. But adding PAs doesn't detract from any of that. It's only additive, and we really do see the benefits.
Absolutely. And I mean, I think our numbers and statistics in my practice have borne that out. PA um, driven procedures and physician driven procedures have both grown exponentially within our practice, as well as patient satisfaction, decreased wait times for procedures. So it really is like a win all around.
So we've been talking about access to care in well-resourced systems and specialty care, but what we know is that primary care is also affected by access issues, right? Here in Illinois, we have more than 3.5 million or so Illinois residents that live in the so-called health professional shortage areas, right? The federally designated regions of the state, which is most of the state of Illinois, honestly, that doesn't have access or immediate access to basic primary care services. So this is something that we're experiencing in every community, and it's not just specialty care anymore. We know that physicians, particularly in primary care and family medicine, are retiring, and newer physicians are coming up and going into specialty practices or just not being drawn to primary care and family medicine the same way that they have in the past. So, what are your thoughts around those kinds of access issues, and how have you sort of experienced them in your practice and in your, community as a patient?
Yeah, I mean, that's the thing is that even me as a healthcare provider, it's become more and more challenging to find primary care providers. I think that a lot of these large health systems are having a hard time recruiting primary care um, physicians because fewer and fewer are graduating. There's more competition for them, and so we find that a lot of the providers in our system, their practices are full, they're not accepting new patients. A lot of our really great primary care physicians have gone into concierge medicine, um, which then makes them unaccessible to a large amount of the population that can't afford that kind of premium service. And, it both myself and the physicians I work with have all discussed, like, "Do you know who's taking new patients? Is there a new physician where I can get
Mhm.
care?" And so to me, like, red lights are, like, blaring, saying this is really a
Yeah.
problem. If those of us that work in the system can't find the care, how is the public getting access to that primary care that's so critical? And I think that's somewhere where PAs are really well poised to kinda come in and fill the gaps there, because again, so much of that is what we are primarily trained to do. That's, like, well within our wheelhouse to do that primary care, make referrals to specialty care when needed, manage chronic conditions like hypertension and diabetes. Um, which reminds I mean, endocrinology is another area where there's just not enough providers,
Yeah,
and
100%.
with the lack of primary care providers, diabetes management, these patients have a very hard time finding a provider to help them manage that condition.
Yeah, when I think about a lot of excellent, great points you just made there, and when I think about things like diabetes, like hypertension, like cardiovascular risk factors like obesity, smoking, things like that, that's really the impact that we're seeing in these communities who don't have access to primary care. Right? These are the conditions that Illinois residents and frankly residents, citizens across the United States are suffering from in these communities. And these are the types of conditions that PAs are well trained and well educated to be able to treat and really make an impact, right? So, I mean, some of the statistics that we've heard recently that are striking is that, Illinois is scheduled to have a shortfall of physicians of over 6,000 in the next 5 to 10 years. And we also know sort of nationally, the trend is in primary care, at least, that APPs are going to be the majority providers available in the United States by the year 2031. So there isn't a
Mhm.
physician only solution to this access to care problem here in Illinois or anywhere else, frankly. And to your point, the kinds of diseases that we see, diabetes, hypertension. These are the kinds of things that PAs are well trained and well positioned to really make an impact on at the community level. And again, not the only solution, but part of a larger solution that includes physicians, that includes APRNs, letting everybody sort of come up to the level of their expertise and training to really provide care.
No, I agree, and I think there's a lot of good research that I've seen emerging that just shows how critical this is, that in these areas where patients can't access this care, that we do see premature death, we see lifespan shortage. And so this is like a really critical issue that I agree we all have to try to be part of that solution.
Well, Deb, thank you so much for talking about this issue. It's an important issue and it's an interesting issue about how we can better utilize PAs both in the rural community and in specialty care to really improve access to care for patients.
Yeah. Thank you so much for having me. I mean, as you can tell, this is something I'm very passionate about. This is why I became a PA all those years ago. And so I'm grateful to be able to have a few minutes of everybody's time to talk about it in more in depth.
That's great. Thanks so much.
Okay, thank you.
So thanks again to my friend and colleague, Deb Epstein, for joining me tonight for this conversation about access to care and PAs. If you want to learn more about how PAs in Illinois are working to expand access to care, please check out our advocacy website at pascare.org. And you can always check out more about the Illinois Academy at illinoispa.org. Thanks again for listening.